is acceptance. Nathaniel Brandon.
Recording in progress.
Greetings to our distinguished guests, faculty in charge, fellow members of Enactus, Kimaya, Kamakshi, Wordsmith, and our wonderful audience. Welcome to this very informative and propitious webinar, period, end of sentence, where we take another step forward to destigmatize menstruation and everything that comes with it.
On behalf of Enactus KISS-KIIT, I welcome our guest speaker, Dr. Parul Sinha, MBBS, MS, Obstetrics and Gynaecology. She's currently living in Lucknow and working in AIIMS, Raebareli. I would also like this opportunity to welcome our first chief guest, Dr. KISS-KIIT. He has been a luminary faculty member for personality development and has also been a notable mentor and teacher of social and conversation skills, which are quintessential for interviews and professional platforms. Our second chief guest is Dr. Shyamsundar Behura, who is the Deputy Director of KIDS, Student Activity Center.
We extend our heartiest welcome to our panel of guests. Thank you for joining us as we try to make a change for the good in our society, which would not have been possible if it were not for your support. Enactus KISS-KIIT is the official extension of the renowned global organization of Enactus. It connects students, academic and business leaders through entrepreneurial-based projects that empower people to transform opportunities into real, sustainable progress for themselves and their communities.
We are also very grateful and glad to have on board with us three other societies for today's event. Kamakshi and He for She Society of KIIT advocates women empowerment and gender equality. It provides awareness to students of the situations humans are facing in daily life.
Kimaya is the official medical society of KIIT, which aims to create health awareness amongst people by organizing different events, seminars, quizzes, and workshops.
KIIT Wordsmith is the official literary society of KIIT. They conduct several events across the year for literary enthusiasts, and their magnum opus is University Students Magazine, Kritika, and KIIT, the University Women's Magazine.
Initiated by Enactus KIIT KISS, My Pad, My Story campaign is a little effort on our part to save the next generations from embarrassment or confusion by educating ourselves and the ones around us. It has been designed not only to target the oblivious masses, but to ensure that the menstruating fraction of the society does not feel isolated at any point.
It is high time that we stop hesitating to question or learn about our own bodies and destigmatize matters concerning a phenomenon that has been predominantly the foundation of our society.
This is just the beginning of a journey towards a world where teenagers aren't shushed when they talk about periods, or where their sanitary napkins no longer require multiple layers of covers to be hidden. A society where people won't feel shame just because they bleed.
Before we proceed to start the most awaited part of the event, I would like to invite our chief guest, Dr. KISS-KIIT, sir, to address the gathering and give the event an enthusiastic start. So.
Okay, thank you for your kind introduction, but you made a mistake there. I should not be the first chief guest. The star of the show, Dr. Shyamsundar Behura, he is the permanent first chief guest of the entire year. Remember that always. All right. Another mistake. You didn't say that I had to give a good introduction. No preparation. So surprise, surprise. There isn't going to be a very structured talk at this part. Okay. The first negativities apart, like coming to the beautiful stuff of the day, is that you got many societies together for a very important thing that the society is facing today, and that is the stigma, the misinterpretation, the misunderstandings about that. And I got such a wonderful personality to dissect it and diffuse the smoke over the whole stuff. Dr. Parul is here. And I'm expecting the number of boys participating in this to carry the message forward to the places where it is rarely discussed, in the male circles, and stop doing stupid, lame jokes about this stuff. The very aware and awake generation, I won't call it woke, But this awakened generation of BTech students were very communicative, expressive, articulate. They're present across the social media. They're everywhere. They're the voice of the youth, the face of the nation, if they get to know the facts, if they get to be clear about what the terminology is about and what the phenomenon is about. Mark my words, this thing will go faster than Elon Musk's rockets. This stigma, this misunderstanding and misinterpretation, it will disappear faster than even Jeff Bezos' rockets. Even NASA won't be able to catch up with the kind of dispelling of the lack of facts, or let's say non-facts, and we will see a much brighter, clearer, and wonderful future. That's all from my side. Let's start the information campaign.
Thank you so much, sir. Your words are always very enriching. Now, I would like to invite Dr. Shyam Sundar Beura, sir, to grace us with a few words. So, please.
A very good morning to all of you. As Kashmir Khan sir said, there's no chief guest, one, two, we all work in a team, and that's what is seen today. You have all the societies together here as a team, to what he said rightly about the stigma that is existing today. So me also, hailing from a medical background, I would very rightly, appreciate and testify the fact what he said is that the community at a large is, like say he said about BTech students, you minus the medical segment, the entire society which is residing today, was residing and will reside, need to be sensitized. That is what is more important. If that society is not sensitized, these things will never go. But anyway, hats off to the efforts of the government, the NGOs who are working on this. There has been definitely a paradigm shift in the uptake of the message that what exactly it is. It is just a physiological or a biological phenomena, and it's entirely related to health. As we take care of every aspect of our body in terms of health, this is also one part of that. So that is now, it is slowly that compliance level of accepting this as a normal biological process in one gender is being accepted. That's the good news, okay? But still, there has to be, it's still a long run. If you go towards all the semi-urbans and rural communities and all, you still find some amount of these issues existing in that. And I think in one or two ways, we have a very, apt person today, Dr. Parul here, who would really, throw light on this and tell you about more on a scientific note on exactly, because they come across, patients and, women by default, they can address her message can tell you exactly what is the ground zero problem, and then maybe we could have a level of compliance on that. So one or two things, like as I said, one is sensitizing the public, both genders, not only the female category, the male categories also. Then you need to empower the woman, okay, through education. So put them into the decision-making role, because we make rules and it has to be followed by them. That doesn't happen. Of course, as I said, government is really working on this low-cost sanitary napkins where, starting from your Anganwadi workers to National Rural Health Mission, all are now working. You have even now budget allocated for these. But whatever it is happening, if we ourselves don't comply to this, we don't actually understand and get sensitized, whatever allotment or whatever laws or whatever rules come, that if there is no compliance, you've gone through COVID, right? So if there is no compliance, there is no use of anything, okay? So with this, let's let the youth be the force of spreading this awareness. It is a very, very simple thing, but people, I don't know why this is so complicated. So that is where you want to make things more simpler now. So let's have a great discussion today. And on behalf of the KIIT fraternity, I also welcome Dr. Parul Sinha from AIIMS Raebareli to KIIT and to this program. Thank you.
Thank you so much, sir. You always you do magic with words. Thank you for explaining things so nicely. Now, moving forward, we start our event with the guest speaker, during which she'll resolve questions and concerns that have been compiled from the registration forms and the inputs provided by the OC. Any queries that may arise in the course of the webinar may be asked by the attendees in the question answer session that will follow. Over to you, Ridhima and Samida.
Thank you, Ananya and Amitabh, for taking us through that wonderful introduction for this event. And now, without further ado, let's move on to the next segment for the day. We'd like to invite our honorable guest speaker, Dr. Parul Sinha ma'am, to commence our marquee event, period, End of sentence. We hope that everybody present here takes something away from this webinar and contributes to bringing about an impactful change in the way we view this topic of menstruation. Ma'am, before we move on to the questions that our attendees have put in through the registration form, is there a message that you would like to put forward to our attendees for this event?
A very good morning to all of you, all the students and the guest, chief guest for today. And as this is a very, very important topic to have been taken over, and it is very nice of all of you to organize this session. And as the chief guest, both the chief guests have already laid down a background for this, that it is very important, and it is very important for both the genders. It is not only education of the females, but also of the males. And that is very important, because this education, this education has to be inculcated in the various schools at the right time. So that is very important, and these sessions should be covered over, like your college is organizing. So these sessions should also be covered over in other colleges all over the country to bring this insight into everyone's mind. So I think we can begin with the sessions, and then we'll get to know what are the questions, what are the queries and doubts, and then we can clear them all one by one.
Thank you, ma'am. That was surely, ma'am, a very strong message, and I guess it will reverberate very strongly within our audience. But now, Rudhima, can we move on to the first question for the session?
Definitely. So, ma'am, the first question is that there have been a lot of recent developments in the market when it comes to the introduction of a variety of menstrual products like period underwear, biodegradable pads and tampons, etc. So, as a gynecologist, what is your opinion or recommendation on these?
There are so many things, like the sanitary pads are being used, but they are also of two types. They may be disposable, they may be reusable. Then besides that, there are tampons available. Then there are these other things like period underwears, panty liners. All these things are available in the market. And there are menstrual cups also. So all these can be used, but there are certain pros and cons of these. Like a tampon should not be in place for more than 8 hours, and ideally it should be changed every 3 to 4 hourly. And it needs a bit of then there are menstrual cups. So most of the females, they are now used to using these pads, sanitary pads, and they are quite comfortable. Then these menstrual cups, they are made of the material, there may be silicone, plastic and other materials, and they are used, they are mostly reusable. They once it is inserted, but it needs a lot of practice. You can say for the first few periods, she will need a practice, then she'll be well versed with the technique. And so it will need a practice. And so she has to go to her gynecologist, and she has to learn to see the method, because all these, there are many videos nowadays, everything is available on net. So these videos can be seen. And then there is no particular recommendation. It depends upon the needs. It depends upon the requirements of the female, and whether what is available to her, what are the methods of disposal available to her. That is what's also very important. And what is the status of privacy where she can change. But all these things have to be available, and these things are being looked after by the government agencies also. And as already been said, that the National Health Mission, they have incorporated this menstrual hygiene and health in their programs, and that is very important. So safe wash program, that is this wash sanitation and water sanitation and hygiene, that is also being provided. So recommendation is that it depends upon the use. But for sports activities, for underwater activities, there it is better if a tampon can be used, if a cup can be used, because there are less chances of it being dislodged, because underwater activities, it needs these cups and tampons, because pads may get soaked and they'll get wet.
Ma'am, being a non-member of the menstrual community, I was also quite shocked when I first came to know that tampons and menstrual cups are better for sports activities. And I think that was a supremely enlightening insight for our audience. And that I'm very sure that our queries of the participants regarding this topic have been more than satisfied. Moving on to the next question for the day. For most women, a normal menstrual cycle ranges from 21 to 35 days. However, 14 to 25% women have irregular menstrual cycles that are heavily accompanied by abdominal cramps and other pains. Why does this happen? And when does it become concerning? Like, at one point, should one consider paying a visit to a gynecologist?
A normal menstrual cycle is actually it is from 24 to 38 days. This should be the limits. These should be the this is the range actually. And so if a female gets menstruation less than more frequently than 24 days, or if the cycle length is more than 38 days, then she has to worry, but not in first cycle. First cycle is not a problem. So if she gets it frequently, so if any patient comes to, if any female comes to us with this a complaint that this cycle she had a period twice in a month, many times they come, so then we ask her to maintain a menstrual diary. So menstrual diary, that means she has to maintain her sequence of periods for a period of 3 months. And that sequence for period of 3 months, she has to maintain how many days she menstruated, what was the cycle duration, what are the number of pads, what was the soakage, so number of pads per day. So that gives us an idea of how serious is the problem. So 24 to 38 days, that is the range. Less than 24 days, more than 38 days, she has to worry. And 24 days, and if it is less than 24 days or more than 38 days, what is the amount? So duration, and second thing is duration. If the cycle lasts for more than 7 days, then that is problematic. So cutoff is less than 7 days, more than 7 days. Then the amount, actually it should be 20 to 30 ml, you can say, but that is not measurable. So we ask by the number of pads she is using. So that is the, you can say the ranges.
I think that answers a lot of queries for all of us here. So thank you so much, ma'am, for providing such a concise answer to it. So the next question is that, ma'am, according to the available statistics for PCOD and PCOS, it affects 6 to 10% of the menstruating population worldwide, making it one of the most common endocrine disorders. So what are some of the early symptoms that might suggest an issue, and can it be prevented by altering our lifestyle patterns? Also, adding on to it, is homeopathic medicine for PCOS and PCOD better than the allopathic ones? Because it's a common concern that taking hormone pills causes a lot of problems in the long run.
So see, the answer is this is now with the so much intake of junk food and with the sedentary lifestyle and with this COVID pandemic. All these things are coming up very frequently, and even before COVID pandemic, the lifestyle modifications which have occurred and the excess intake of junk food. So that has resulted we are seeing a lot of girls who are coming with this complaint. So PCOS, actually, this is a spectrum of disorder. So it includes many things, like it may be menstrual irregularities. There are signs of, there's a term known as hirsutism. That means excessive hair on face, on other body parts. And so that is because of excess of hormone. So the hormonal imbalance. So the patient will, in this condition, the patient will come with a complaint of she may be having acne, she may be having excess facial hairs, and then menstrual irregularities, which may range from she may be having no periods or prolonged periods or very irregular periods. So all these things, these are the this is the variety of complaints which she comes, and mostly the patients are obese in this case. So her BMI is basal metabolic rate is high. So that is a cause of concern. So whenever the patient walks in, and we can judge by her look also, that seeing her face, facial hair and all those things, that she is a PCOS patient. So PCOS patient, and we cannot say actually we should not say a patient, because this is a syndrome, and then many females nowadays have this problem. So I think this is, and as you have said, now your next question is lifestyle modification. Definitely lifestyle modification is a must, and we advise the patient. There are so many criteria laid down in the various guidelines, but actually I won't go into detail. So if she has a problem, the exercising is a must, and it is not light exercise. It should be heavy exercise, and it should be at least 5 times a week, 5 days a week for 30 minutes, at least daily. And that is a mild form of. So more than that, it should be, she should consult a doctor if she is having any such complaints. And so lifestyle modification, dietary modification is a must. Low of fat, low of sugars, calories, these all have to be looked upon. And then their third question, any other medication, but actually because I am allopathic doctor, so I actually, many people, what happens that people go here and there, and then first because they avoid coming to allopathic doctor. It is a common tendency in India. They go to Ayurveda, they go to homeopathic, because they say, my so-so and relative, they have said that they got treated by this thing. So they say that, yes, this thing because ultimately they come to us. The problem is that ultimately they have to come to us. And so it is better that you go, because what happens, that the problem is in later fertility. PCOS is a very important cause of infertility. So she she is wasting her time at present. A lot of time is being wasted in doing doctor shopping from here to there, and then she finally comes to us. So I think if she has any such problem, she should come to a gynecologist or allopathic, and if she wishes, she can go anywhere. It is her choice.
Ma'am, in the same context, if I might add, a question kept popping up that is PCOS and PCOD the same thing, or is there a borderline difference between the two?
Can you repeat your question, because there was a network issue?
Yes, ma'am. Yes, ma'am. So, ma'am, one more question that kept popping up in the questionnaire that we had laid out was, is PCOS and PCOD different, or can they be used as interchangeable terms?
No, they are same thing. Initially, it was polycystic ovarian syndrome, and now it is polycystic ovarian disease. So syndrome actually is, what do you mean by syndrome? Syndrome means a group of complaints or group of symptoms which come together. So we label them as syndrome. So in PCOS, there are ultrasound changes in the ovary. Then there are these menstrual irregularities, and then there are features of hirsutism, hyperandrogenism. We can say that acne, hirsutism. Hirsutism means excess of facial hairs. So all these features, they make up a syndrome. So when we combine it, it is called polycystic ovarian syndrome, but nowadays we use the term polycystic ovarian disease. So they are almost the same thing.
Okay, ma'am. Thank you for clearing that once and for all. It has always been kind of a gray area for people. Moving on to the next question. Most people think of periods as a predictable part of one's life, but individuals often notice irregularities that seem to be connected to one's mental well-being throughout the cycle. Now, with the change in our lifestyles that has been induced by this pandemic and the stagnancy that it has effectuated, many people have noticed a change in their period patterns, where the days and the flow have reduced significantly. Are these two terms related in any way? And also, do antidepressants affect one's menstrual cycle?
So actually, as I have told you, that this pandemic has created a lot of mental stress. We have seen so many lives gone, and a lot of stress for everyone. So this stress has a very important role on the hypothalamic pituitary ovarian axis, which is responsible for the normal menstrual cycle. So this is one of the factors which affects the menstrual cycle pattern and the regularity of this menstrual cycle. So stress in any form, and this, as we know, this pandemic has created a lot of stress, and so this has affected the normal menstrual patterns. And because and along with it, the sedentary lifestyle, that work from home pattern, the schools are also not functioning, the students are sitting all the day with their phones and with their laptops. So this all has a very large impact on the pattern. And what is the second question?
Yes, ma'am. The second question was, are antidepressants affecting one's... Yes,
antidepressants definitely have a role, because they are the dopamine receptor. They affect on dopamine receptors. So dopamine receptors, definitely they are involved in regulating, they are involved in the disturbances patients who are on antipsychotic medications, they come to us and they come to us with this complaint that they are not having any periods for such a long time since the medication started, because these drugs have the effect on the pattern, on the hormones which are released from pituitary and hypothalamus. So they definitely have an effect. So we just counsel them that this is a normal pattern and they don't have to worry. Once their medication stops, then they can have the normal menstrual cycle. It is not permanent. It is not, there's nothing permanent in that.
Thank you so much, ma'am. I think been there, experienced that. So that answer really helped us. Okay, so moving on. So while you were going through the responses in the registration forms, the most common concern that we came across was period cramps. So I've been there myself where I've had intense cramps and I had no point but to sit on the bed all day or take painkillers instead. And then again, there's a huge myth around the taking of painkillers. So are painkillers really the kind of villain they're perceived to be?
The menstrual cramps, they are normal. Actually, why do they occur? They occur because there is the menstrual cycle. So shedding of the lining of the uterus, from where this menstrual blood comes. So there's shedding, and that shedding, the uterus is a very small organ when non-pregnant uterus. During pregnancy, it enlarges so much so that it can accommodate the baby. But actually, it is a very small organ, and the cavity which is present is very, very small. So when the menstrual blood accumulates there, so anything which has to go out, there will be cramp, there will be spasm to release it. So that is a normal phenomena. But when is it problematic? So if a person is having such cramps, so she can take normal these painkillers like ibuprofen, naproxen, and all these painkillers. Most of the people, they are taking meftalspaz. Many people are taking meftalspaz. So if it is relieved by that, it is okay, and you can take it. There is no problem, because you have to take it for 3 days, 3 times a day for 3 days. So there is no problem. So these and painkillers can be taken. Now, problem is when it is so much that it is disturbing your day-to-day activities, your emotional and your physical well-being. You are not able to do your day-to-day activities. And as you said, you are bedridden. So if it is so much of a problem that you're not able to carry out your daily activities, then you should be worried and you should consult a doctor. So a gynecologist you should consult, and in that there may be many causes. So nowadays it has been seen there is a term known as endometriosis. So endometriosis is presence of this menstrual blood in other sites. That means it is not in uterus, it is in ectopic, other sites. So when the menses occur, that areas, and because that will be in other areas of the abdomen. Abdomen means this cavity in which all the organs are lying. So when the blood is present there, so during menstruation, when the endometrium, that is the lining of the uterus, that lining of the uterus is present anywhere in the abdomen, then during menstruation that also starts bleeding, and then it causes irritation, and then that is a problematic thing, because it may lead to infertility. It is a lifelong problem if it is not consulted at the right time. Then there are other things which you must have heard: fibroids. Some say there is a tumor. So fibroids may also cause painful excessive pain during menses. So these are a few of the things which excessive. If it is excessive, then you have to consult it definitely. But if it is normal, there's no harm in taking a painkiller.
Okay, ma'am, also, what steps can a menstruating person take throughout the month or during periods for reducing the pain, if there are any?
Definitely, for the steps which can be taken, she can, like if it is paining, like we have hot water bottles. If there is excessive pain, she can apply those. Exercises, regular exercises, they also have a lot of impact on reducing this menstrual pain. So exercising is very important. Regular aerobic exercises can be undertaken. Then there is a hot bath is also very helpful in that. So, and besides that, painkillers. So these are few of the things that, and they have been prescribed some syrups like for this also, like M2 tone. They're commonly in the market, some syrups of some other companies, so they can also be prescribed. They help a lot in these. And now in this there comes the role of Ayurvedic, those Ayurvedic syrups which all of you must have heard of. This reduces the menstrual cramps, and I don't have much knowledge because I haven't read the research on that, but that is more of a placebo, because placebo is also placebo. I think all of you understand what is placebo. That is not actually a medicine that is given to the patient to saying that yes, it will give you relief, but actually there is no medicine in that. It may be any sugar pill or anything. And so I think these syrups are more of a placebo, but then many patient gets relief. So a psychological functional component is also there. And for that, there is a need of counseling before the start of these menses to the females. So that counseling is very important. They must have knowledge of that, because it is a very different thing. It is a very different thing for a female to suddenly start menstruating, to start getting blood. Seeing many people, they are just seeing at the sight of the blood coming out from their body is very repelling, you can say. So this proper counseling, proper education at the right time is a must for, because many of these things may be reduced by this counseling also.
Okay, ma'am. Even though the menstruating part of our society can't have their pains cured magically, gaining a clearer picture of the same, I'm sure will help them put their minds at ease. Thank you so much again, ma'am, for that. Now, just like menstruation, vaginal hygiene is also a taboo subject in India. And an overwhelming majority of our menstruating population till date refrain from talking or sharing tips on how to maintain proper vaginal hygiene. However, it is crucial that people are aware of the appropriate methods for maintaining proper vaginal hygiene. So, what are the steps or ways in which one can sustain vaginal hygiene on a daily basis? And what are the do's and don'ts related to the same? Like we see a lot of products available in the market for that purpose, but do they actually work, and do they have any benefits or detriments?
Nowadays we are seeing so many ads for these vaginal hygiene products, intimate hygiene, V-wash and all those things, but definitely we prescribe them only when we see the female, she is having any problem, because these have the mechanism on which these work, it is on the altering the vaginal flora, the bacteria, the bacteria which are normally present in the vagina. Many bacteria are normally present in the vagina, and so, but they are useful for us. But sometimes when there is some infection, those bacteria, they are absent, they are reduced. And for that, to rejuvenate those bacteria, or seeing the ad, every female should not start using it. Now, the problem is that actually what happens that this washing the genital area. Now, first of all, I would like to talk about the hygiene during the menses. Now, during the menses, she must be first of all, the cloth, the material of the this underwear, the panty which should be used, that should be breathable. That means it should be cotton. It should not be no synthetic cloth should be used, because then it captures moisture, it captures heat, and then that leads to growth of bacteria. So breathable clothes, light clothes, and those loose clothes should be used during this this thing. And the pads, they should not be used for more than 4 to 6 hours. So that is the ideal time. Even if it is not soaked completely, they should be changed. So this is one thing. And they should not wash the genital area with soap. Soap should not be used, because as I've told you, the normal flora is disturbed. So soap is not used. Gentle warm water should be used for cleaning the vaginal area, and it should not be very rigorously cleaned, because rigorously means that in depth, because that will reduce the remove the normal flora, normal bacteria. So this is very important. Avoid Dettol, avoid Savlon, avoid soap or all these things on the genital area. So it is better, and at least during the menses, clean it twice a day with warm water. No soap, no Savlon, no Dettol. Then there is this question like what all then there may be many patients are troubled by the this thing, they are having discharge per vaginum. So I think we'll cover it later, but first we'll just so menstrual hygiene, as these are the points which she should have. And then during these menses, she should have access to this safe environment for changing her pads and for proper disposal. So that is also very important.
Thank you so much, ma'am, for that answer. It really does help us, a lot of us. So moving on, so every menstruating person has been there, myself included, where a wedding or a beach holiday coinciding with a menstrual cycle. However, with the advancement of medicine, it has become absolutely possible for us to delay our periods. While all of it is pretty convenient, the debate around the ease of period suppression has invited criticism and makes one wonder if it's safe in the longer run. Ma'am, if you could please throw some light on this.
Actually, whenever the periods can be postponed if there is need, but not very frequently. Like we prescribe medicines, but these medicines, they are prescribed at least 6 days before the onset of the normal periods. But this can be prescribed only if her periods are regular. If her periods are irregular, then we cannot actually know when she will have the periods. So it can be prescribed at least 6 days or even more than that. Even before that, she can be prescribed medicines, and that she has to take till the time she wants her period to be delayed. And if because once she stopped the drug, the period will resume after 3 to 4 days. So till the time she wants to delay her period, it has to be continued. That drug has to be continued. And that is basically a hormone. That is a progesterone. There are two types of hormones which are normally involved in menstrual cycle, estrogen and progesterone. And so here we give progesterones only medication, and so that is used for withdrawal. There is no harm in it, but it should not be used too frequently. So that is why here comes the importance that if she wants to delay, she wants to go on a trip and she wants to go anywhere. So here comes the importance of availability of safe, friendly, acceptable environment for the proper disposal, proper changing of pads everywhere. Like if you are going on trip, most of the time this problem comes when a patient is going on a religious trip, either any religion. So on the way, there should be proper toilets for females with proper facilities, with proper privacy, which is acceptable to the patient and according to the culture of the patient, according to the culture of the female. And so these are the prerequisites which should be fulfilled. So frequently she should not take, but once in a while she can take.
Thank you, ma'am. Since the introduction of such medications with the advent of medical sciences, this has been for long an extremely controversial topic. So thank you for clearing the air around it once and for all. Now, ma'am, the next question will give us a glimpse of your personal perspective into this whole topic of menstruation. So our attendees want to know, ma'am, what are the changes that you personally have seen or wish to see in, say, schools, colleges, or workplaces that would support the menstruating people in our society? Like, is there something which you would like to suggest that we as college students can do so that we can level up this initiative that we have embarked upon?
See, first thing is, which I've already told you, that at the school level, when this puberty is going to start, at the age of puberty, these students should be taught, and not only the females, the males also, both the genders, they should be taught about the importance of this menstrual hygiene, and why does it occur? What is the pattern? It should not be a taboo. They should be told, like, our culture, the cultural beliefs create a great amount of taboo on this subject. Whether talking about it when the menses start, all these things need to be stopped, and all these things need to be taught to the this education regarding this, like we are giving sex education. So this education must also be given to the students. I don't know, because in whether it is prevalent nowadays, because in my school days it was not there. So at that time there was no education. Suddenly suddenly there are so many changes occurring in the body, and which you have to adapt yourself. So this education was never imparted, and I don't know what is the scenario at present, whether it is being done or not. And then again, such your college is organizing such things must be organized off and on, so that to give knowledge about it and to gain newer developments, what are the new things, so that you are also updated, you people are updated, like what all the new things which are in the round, and which you can make use of for your purposes, and which you can help. And you can also go in the field, like you may be, I don't know whether you have projects or such like related to these or not. You can go out in the field to help others, to help impart knowledge about this. You can make groups, like there, I think there's some associations or something like that, which do these things like social work. So maybe all this can be done. And besides, one more important, the schools and colleges must have this separate area, like along with the toilet of the females, a proper provision of washing, hygiene, and proper provision of these. Maybe sanitary pads should also be available, so that if in an emergency, the female does not have to run about, does not have to worry about it. Suddenly she is in a fix, what to do. So all these things must be made available. There must be a section in the female toilet where everything must be available.
Thank you, ma'am. I think we all have a new idea and way to proceed, being college students ourselves. So now, ma'am, the last question that we have is, as a person with a vagina, we all know that vaginal discharge is a fact of life, and we may not even think twice about it. But to be honest, a lot of us don't even know what discharge actually is, and how can we tell what is normal, or what may be an indication of a problem. Also, adding to it, even when we're taking good care of our body and our vagina, we sometimes experience unfamiliar smells. So what is typical and what is not?
The normal, actually, the vagina secretions, they are also, and they can be physiological. Physiological means it is normal, pathological means it is abnormal. So how do we differentiate between whether it is normal or whether it is abnormal? So now, what are the things? If it is occurring after menses, sometimes a discharge, it continues after menses for 5 to 6 days, then that is normal. The consistency, whether it is thick, whether it is thin, so whether there is any foul smell, whether it is associated with any itching of this vulval area, perineal area. So perineal area, that means in the private parts, if it is associated with any itching. So all these things, itching, foul smell, and whether it is amount is excessive, that you have to use some pads like panty liners, etc., for that discharge. And if it is regular, that means if it is continuous throughout the cycle, so then that it is problematic. So then that means, and if it is associated with any pain in lower abdomen, that means lower part of the this body, if it is associated with any pain which is radiating to the thighs, to the back, then it is problematic. If it is not associated with these signs and symptoms, it is only for a few days after menses, then it is normal. But if sometimes what happens, that there may be few conditions in which we may say that there is vaginitis, then there is vaginitis means vaginal infections, then there may be pelvic inflammatory disease. So what happens, that first of all, it is localized to the lower part of the body, lower part of the genital area, and then it moves upwards towards the uterus, and from the uterus it may go on to into our abdominal cavity also, where it becomes generalized. So if we have to stop, if the discharge is pathological, we have to stop it at the lowest point, so that it does not proceed upwards. And for that, we have to recognize that what are the features, as I've told you, that it is foul smelling, if it is itchy, if there is excessive, if it is very thick discharge, if it is this color also, if it is yellowish color, greenish color, sometimes light yellowish tinge, greenish tinge. So these are abnormal pathological discharges due to some bacterial involvement.
Again, a very beautiful explanation by ma'am. And I'm sure that our audience has had enough food for thought and possibly some more questions that they would like ma'am to clarify. So with that, we would like to conclude this vibrant questionnaire session. It has truly been a great experience hosting you at this event, ma'am. But for now, we move on to the next segment of the day, which is the Q&A round. So on to you, Arushi and Nikhil, for the next segment.
Thank you, Ridhima and Samida. The session was indeed an edifying one. When there's a why, the how becomes clear. On that note, we would like to invite our audience to raise a few questions by raising their hands or put down their questions in the chat box. The first question would be taken up from Eshika.
Thank you, Arushi. Good morning, ma'am. So my question is basically that sometimes I start feeling abdominal cramps before I actually start my periods. Like before a week, I start feeling, cramps, which are like not even like subtle, they're very intense. Like they happen during the actual period. So is it an indication of an underlying issue, or is it like normal?
So I just want to, because your question has raised a very important point. There is a term known as PMS, premenstrual syndrome, or we can also say and when it becomes severe, it is a premenstrual dysphoric disorder, PMDD. First is PMS, and then when it progresses, when it becomes severe, then it is premenstrual dysphoric disorder. Now PMS, what happens, that the symptoms of many of you must have experienced, there's breast tenderness, there's bloating, abdominal bloating, there is this menstrual cramps may be felt a week before, and then it continues after. Means there is some problem. And one more thing which I've told you, endometriosis. If the periods are so severe that if the cramps are so severe that they are occurring before the onset, 1 week before, and then at that time it must also be associated with passage of clots also. Maybe many of you must have felt that there are passage of clots during menses and it is excessive, the duration is increased, then you have to definitely consult your doctor who will get an ultrasound done. The gynecologist will get an abdominal ultrasound done, and it will make the picture quite clear in many cases. And for PMS, PMS is also very common. They started feeling of bloating, abdominal tenderness, this breast tenderness, swelling, all these feelings come. And so for this, you can, a few vitamins, vitamin D1, and all these may be prescribed, but once you consult a doctor who will examine, and then they will prescribe you the required medicines.
Thank you, ma'am. I think that covered a really essential topic that was must have created doubts in the minds of many. Moving on, the next question we'll be taking is from Swati Das. Swati, you can unmute yourself and ask the question.
Yeah, sorry. Good morning, ma'am. My name is Swati. So can depression and bad mental health in general affect menstruation?
Yes, definitely depression, and because I have told you stress is a very important cause for this disturbance of the HPO axis, hypothalamic pituitary ovarian axis. So it creates problem at every level, because the hormone is released from hypothalamus. I hope you have some knowledge of what is hypothalamus, what is pituitary, and what is ovaries. So the cycle begins from hypothalamus. From there, the hormone is released, which acts on pituitary. From there, another hormone is released, which acts on ovaries. And then the ovaries, they stimulate the uterus to produce menses. So any disturbance anywhere, and this stress is a very important cause of that. So this thing is very important. And besides, I want to make one thing very clear, that when there is menarche, that means the onset of menses. So first 2 years after menarche, when the menses start, that means 13, 14 years or whichever date. So first 2 years, the periods may be very irregular. So at that time, it is the female need not worry very much until and unless she has having a lot of problems. First 2 years, because there is no ovulation. Ovulation means eggs are not released from the ovaries. So the cycles may be very irregular, but it may be that she may have started her menses, and then for the next 4 months, she did not have any menses. So at that time, she need not worry very much. But after that, she has to consult some.
Thank you, ma'am. That was a very insightful answer. Next, we would go to Suhani Das.
Good morning, ma'am. I'm Suhani. So, ma'am, my question is it advisable to work out or do physical exercises during menstruation, and what effect can it have? I mean, during the period we are menstruating.
It will have no effect. It will have a good effect, because I've already told you that if you want to reduce your cramps, if you want to reduce your problems during menses, then you can definitely have this thing. You can definitely exercise. Exercising is always beneficial. It is never harmful, and it will have indeed a good effect on it.
Thank you, ma'am. Next, we'll take a question from the chat box. It is by Mahatvakanshi. The question is, why period blood color is different sometimes?
Color is, I don't think, because sometimes what happens when it is collected blood, sometimes because period blood is never frank red in color. It is always a darker shade, because that is shedding of the lining of the uterus. And so it is always a darker shade. Sometimes what happens when there is excessive bleeding, they tend to form clots. So when clots are formed, then it is a bit darker color. And if it is, if there are many clots, then you have to consult your doctor, because the clots may be a problem that you are bleeding excessively. Clots is a signal that there is excessive menstrual bleeding. This is not normal. Generally, normally females do not have clots, but if she is having clots, very dark colored blood, then she has to consult.
Thank you, ma'am. Next, we have a question in the chat box by Manvi. She's asking, ma'am, could you please specify foods that promote good amount of blood during periods? Also, ma'am, should we drink more water during periods, or should we drink water only when thirsty during periods?
Actually, drinking water it has no relation with this thing with periods. We should drink water more. Thirsty, we must make a habit that we should drink 6 to 8 glasses per day. That should be a habit, and that is not association with, till now I haven't found any association of drinking water with this menstrual blood. And but few things they are said that coffee intake should be reduced during menses, but actually we never counsel patients like you should reduce coffee. Exercises, we have said they are better, and hot bath and warm warm applications, they will improve all the symptoms. And I don't think any such lifestyle modifications apart from these, I don't think any will be helpful.
Thank you, ma'am. I hope that resolves your doubt, Manvi. And the next question we'll be taking is from Nikon. She has written, is it normal if painkillers hardly work or work really slowly? I experience this often. However, the doctor said there is nothing wrong.
No, painkillers generally work work properly, but sometimes what happens that that pain, actually it depends upon the threshold of the person also. Some people, they have less pain, but they experience more pain. Their pain threshold is very low. So, and some have very high threshold. They may be experiencing a lot of pain, but they may not be expressing it. So it depends upon. So therefore, here also comes the role of counseling, that they must be told beforehand that this is normal. A bit of pain, you cannot get relieved of pain because something is going out of your body, and to expel that out, the uterus has to contract. It has to contract, and that contraction that leads to pain. So a little bit of pain is normal, and that should be borne in mind, that you have to bear that pain. You have to, but a lot of pain, then it is problematic. Then you have to consult.
Thank you, ma'am. We really appreciate this thorough answer. This leads us to the next question by Achal Gupta. She's asking, how can we cure PCOD naturally without any medications?
Naturally is lifestyle and dietary modification. Lifestyle modification, sedentary habits, quit your sedentary habits, exercises and weight bearing exercises have to be done. Rigorous exercises have to be done. All those guidelines, all those are laid down. So once you visit your doctor, like moderate exercise, rigorous exercises, depending upon the weight loss, amount of weight loss you require. And we always tell that even if you lose 2 to 3%, yeah, or up to 5% of your weight, a lot of problems they resolve by themselves. And one very important thing in PCOS is that sometimes PCOS patient, they have, now PCOS is a very important thing because it later on leads to metabolic syndrome. What is metabolic syndrome? Diabetes, hypertension, abnormal lipid profile, cholesterol problems. So all these things, they are later on infertility. So all these things are later on caused by PCOS. Therefore, it is very important that we them. And so it is these are the only modifications. And we say that sometimes many patient comes and they want to reduce their weight, like sometimes 80 kg, 75, 85 kg, and they say that doctors give me some medicine for reduction of my for reducing my weight. But then medicines never work generally. But nowadays few medicines are coming, but they are under research, which will help to reduce the weight. But mostly it is by the person herself. She has to make efforts to reduce her weight, because weight reduction is the best treatment for PCOS.
Thank you, ma'am. I'm sure that cleared the doubts. Next, we have Anvesha Mishra. You can unmute and ask your doubt. Anvesha, you.
Hello, am I audible?
Yes, you're audible.
Okay, so what I wanted to ask was that usually after workout, like I usually suffer like bleeding for like a day or two. Like, is that normal?
Usually after workout, you are not having menses, and every time
Yeah,
you go.
No,
it is not.
it's usually like some intensive workout. Like I'm going like for like a huge like long hike or something.
No, then it is not normal, because that is cyclical bleeding. Has to be cyclical. If you are getting a bleeding after workout, it is not normal. So there must be some, because this is not the routine. Do you never get you do workout, intense workout? Then if that is a reason, that if you work out and you get bleeding, then people will stop working out. They'll say that why should I do exercises when I start bleeding? So that is not normal.
Okay.
Thank you, ma'am, for the answer. Now we'll take up a question from Shrija.
Hello, ma'am. Good afternoon. My name is Shrija. Ma'am, I have this very personal question, I guess. So for the whole month, I have these various days where I feel very dizzy. And I have noticed that these days usually surround my periods. It's either post my period cycle or before I get my periods. So, like, is it normal to feel dizzy, or should I see a gynae?
Dizziness, I have told you, this is a premenstrual syndrome, PMS. So same thing, PMS is a very common thing, because many people will not know. They will think that it is normal. Dizziness, I've told you for a few of the complaints: dizziness, headache, mood swings. Mood swings are also very important. They may feel irritable, unnecessarily angry. So these are few of the features which are part of premenstrual syndrome. And so premenstrual syndrome, and that later on, if sometimes it may lead to premenstrual dysphoric disorder. When it becomes very severe, patient will be very irritable. She may be depressed, highly depressed. So that is that all these things. So if you are encountering these problems, you should consult, and generally few vitamins we give, and then that is resolved. That is not very difficult to handle, but you should not let it.
Thank you, ma'am.
Thank you, ma'am. The next question that we'll take is from Adraja. She asks, ma'am, are tampons or menstrual cups better than sanitary pads? Ma'am, should I repeat the question?
Yeah. You can please repeat.
Yes, ma'am. The next question was by Adraja. The question was, are tampons or menstrual cups better than sanitary pads?
You cannot say, as we cannot just say that this is better or this is worse. This depends upon the condition in which you are working. So pads, and it depends upon the comfort and acceptability of the female. Tampons, you must, sometimes some people are very uncomfortable in putting in tampons and cups, they feel, and some people are comfortable. So these are all the options which are available to us, but we must always remember that there are two types. And sometimes one thing I would like to point out here, that there are some are more absorbent tampons, so they are known as something super absorbent type of thing, and sometimes it may lead to toxic shock syndrome. Very rare, it is very rare. So that is a bacterial infection, and that may lead the patient into septic shock. That means she may go into sepsis, because when it is very absorbent, so it will people tend to remain it, keep it inside their body for a longer time, because it will absorb more and more and more. It will keep on absorbing. So they tend to keep it for a long time. Then what happens when they keep it for a long time? They tend to forget, and then it may lead, in very rare, I'm repeating again and again, very rare cases, it may lead to toxic shock syndrome. Therefore, if a tampon is being used, it should be of low absorbing capacity, and it should be changed every 3 to 4 hours. In no case it should be left after 8 hours. And what the person can do, they can keep the tampon inside during the day. They can use the tampon during the day, and at night, during the night, overnight, they can use the pads. So this is the usual advice.
Thank you, ma'am. Now we would take a question from Sneha. Is it normal if we experience white discharge on the 14th or the 15th day of our periods? Also, could you give a little detail about dysmenorrhea?
So the discharge on 14th or 15th day, if it is occurring every time, because normally 12th day is the time of 12 to 14 days is the time of ovulation. Ovulation means when these ovaries are producing the eggs, and those eggs are being released. So ovulation, the eggs are being released on the 14th day. So if there are menses for 2 to 3 days after ovulation, that is normal. And if it is not associated with any of the features which I have just enumerated, so then it is normal. So actually, but if at that time also, if it is associated with intense itching, if it is associated with foul smell, dirty colored discharge, it may be blood mixed discharge, then you have to worry about. And then dysmenorrhea, it means the same thing, pain during menses. So dysmenorrhea actually is the medical term for pain during menses. It may be of many types. I've told you the reasons for that. It may be normal, physiological, which I've told the reason, or it may be pathological. Pathological, I have told you, like it may be in fibroids. There's a term known as endometriosis. It is associated with severe dysmenorrhea, and it is the most common cause of dysmenorrhea, pathological dysmenorrhea in adolescent.
Thank you, ma'am. I hope that clears your query. Next question we have is from Shamisha Gautam. Is there anything that can be done to control mood swings, anxiety, anger, etc. during periods?
Yes, all these for any, not only during periods, options, meditation, yoga, exercises, all these things can be done to calm your mind, during these periods. And you should have to make up your mind that this is a normal process, this has to occur every month, and you should learn to accept it. The person must learn to accept this, that this has to occur. And besides, the various methods of calming the mind can be done. And if it is very problematic, then there are a few vitamins, vitamin B1, then there are a few drugs which can be prescribed, but that is on the consultation of the doctor.
Thank you, ma'am. That was a very detailed answer. Next, we have a question from Isha. May I have Ma'am, I have heard a myth that doing hair wash during first 3 days of the period can increase risk of breast cancer. Is it true? Is hair wash in any way related?
Actually, the network is quite
Yes, ma'am.
unstable here.
I'll
So,
repeat the question.
No, I've heard the question.
Okay.
So, washing your hair during the first 3 days is not at all no effect on this menstrual any regularity or menstrual cycle. So it is not at all any effect on this. One thing I want to add that during menses, there should be no shaving of hair and waxing and all those things should not be done because the menstrual blood is coming out, and that menstrual blood creates a flora for this thing for bacteria. So bacteria to grow. So because that shaving and those waxing hair, that may lead to because it creates a raw area, and so that promotes the growth of bacteria. So all these things should not be done during periods.
Thank you, ma'am. That was a very informative answer, and I hope that cleared the doubts you had in your mind. Anyways, moving on, the next question will be from Aditi Srivastava. She asks, ma'am, I generally have a period of 2 days or maximum 3. Many say this is due to my weight. Ma'am, is it true? What should I do if it is abnormal to have 2-day periods?
If you are having if the 2-day period since the onset of menarche, since you if your pattern is like this since the time you have started menstruating, so it depends what are the number of pads you are using per day, what is the amount which is coming out. So sometimes some patients, females, they have periods for 2 days, and the 3rd day or 4th day they have just mild spotting. So if this pattern is persistent since your menarche, then it is okay. But if initially it was normal, when you started menstruating, it was normal, and after 5 to 6 years, it has become the pattern has changed. Suddenly you have started menstruating less, the number of days has decreased, then there may be the same thing. It may be an onset of PCOS, or it may be onset of, and in our country, the tuberculosis, genital tuberculosis is a very important cause of decreased in the menses decrease in the amount of menses, because tuberculosis is prevalent. We all think that tuberculosis we are not having, but what happens if someone in your family or somewhere has this tuberculosis of anywhere, bone tuberculosis, lung tuberculosis, because the female will not have any symptoms of tuberculosis, but it goes she may have this problem in menses, and this problem, because genital tuberculosis is also very common without any symptoms. She may have abnormal discharge also. This is in our country, abnormal discharge, the cause of abnormal discharge, tuberculosis is very important cause.
Thank you, ma'am. Next, we have a very important question to be talked about. I heard it's from Shreya Mishra. I heard prolonged use of menstrual cup affects vaginal elasticity. Is it true or is it a myth?
Prolonged use of menstrual cup, I don't think I have don't think I have heard this thing, or I have read about it somewhere if it reduces vaginal elasticity. Otherwise it would not have been used, because if vaginal elasticity is used, there are so many problems which may occur later on. There may be prolapse or all those things. I till now haven't read about it anywhere that it reduces vaginal elasticity, but menstrual cups, they are being used nowadays. They are being used quite commonly, and they are reusable also. That they can be reused, they are inserted. Although the first few periods, they may be you must have the practice of inserting, and then later on it becomes easier. And once it goes, it can be it is removed, and then it is cleaned, and then it is reinserted. So it is quite easy. I don't think I have heard about it till now.
Okay. The next question. Thank you, ma'am. The next question we'll be taking is from Manvi. Excluding the physical features part, ma'am, is there any other procedure or examining process that doctors do to make sure the patient has PCOD or PCOS to confirm it?
Yes. I've told you it is a syndrome, is a amalgamation of 3 features. One is the menstrual irregularities. Second is features of hyperandrogenism like facial hairs, acne, all those things. And third is ultrasound. So in ultrasound, ultrasound is done. So there may be a appearance of polycystic ovaries. Polycystic ovaries means there may be multiple cysts will be seen in ovaries, which are arranged peripherally around the edges of the ovary. So that is a feature of polycystic ovary. But one thing is very important. Sometimes we get many patients who bring an ultrasound and it says that there is a polycystic ovary. But polycystic ovary per se by itself, without any other two features of menstrual irregularity or hyperandrogenism, is not significant in adolescent, because many adolescent females, they have these polycystic ovaries and they may be referred unnecessarily to a gynecologist just by any doctor saying that you have PCOS, because I have told you again and again, it encounters three problems, three things, and at least two of these must be present to make a diagnosis of polycystic ovarian disease. So if there is only ultrasound findings and no other features of neither menstrual irregularity nor any these features of hyperandrogenism, then it is not problematic.
Thank you, ma'am. Now we'll take a question from Divya Verma. You can unmute yourself and ask the question.
Hello, ma'am. Actually, my question, as you said, in tampons, we can use it to 6 to 7 hours, maximum to 8. So as in menstrual cup, we can reuse it but after a particular time. So how long should you change the cup after how long? Like as it's here.
For cups, it is said that when they are full, then you have to remove it and clean it and then reinsert it. So there's no particular for cutoff for these cups, menstrual cups. They have to be, when it is full, it has to be cleaned and then it can be inserted. Sometimes it is also said that if there is no facility for cleaning it, or then when it is full, it can be material can be thrown out and then it can be reinserted. And whenever you are in place where you have that facility available, then you can clean it.
Actually, I was asking, it says we can reuse it like for months, like 1 year or 2. So as I said in like previous articles, for how long we can use that particular cup? In
that particular cup, that I have to because actually that I have to see for how long we can use one cup. You want to ask that, na, for how long we can use one cup. So that I generally, because we are not prescribing it so much, so I don't have much idea about that. But for the patients who are, because these are mostly for those who have to long office hours, who have these I've told you, underwater activities, sports activities, those generally they use. So for how long, that I really have to check out.
Okay, thank you.
I hope in the wake of this insightful questionnaire session, the menstruating as well as non-menstruating circle have gained wisdom about a seemingly squeamish and stigmatic topic in the society, well known as periods. Hence, breaking the negativities and over-exaggerating the misconceptions revolving around it. Now, continuing after us would be Achintya.
On the rag, girl flu, back in the saddle, jam and bread. These are just some of the many euphemisms used to avoid the embarrassing subject of menstruation. It's high time to talk openly and honestly about the basic biological function of the human body, regardless of the gender. This webinar was just a stepping stone in that direction, and we still have a myriad of obstacles to conquer if we are to establish a safe menstruating environment. We need to establish a space where everyone can get comprehensive knowledge about anything and everything related to menstruation and ask questions without feeling ashamed.
Undoubtedly, this was one memorable experience for all of us present here. And now that we are wrapping up with this webinar, we would love to hear feedback from our honorable guest speaker herself. So now, I would like to invite Dr. Parul ma'am to grace us with few words about what she feels after this event.
Actually, in the first go, I would say I would like to congratulate all of you for organizing this event. And it was a very good initiative on your part, because this is to speak on this subject and to invite so many queries and doubts on this subject, on such a taboo subject, you can say, where people, and with all, it is not only girls amongst you, both the girls and boys have been actively involved, and it is a very good initiative on your part. And these sessions must be organized off and on, as I'm continuously saying, with involvement of both the genders, so that we reduce that taboo which is amongst us regarding this subject, which is generally in our homes we generally do not discuss it. We fail to discuss it amongst others, and it is just a hush hush sort of affair in our homes. And so it is good you have come out with such a topic, and this should be continued for long, and for the next sessions also.
Thank you, ma'am. I guess I speak for all when I say this afternoon and its entirety owe its success to your ever-enlightening and gracious presence.
Thank you.
Now, I would like to invite Shrija Verma, Director Stratcom, Enactus KISS-KIIT, to extend a vote of thanks to our guest speaker and everyone present here.
A very good afternoon, ma'am. I am Shrija, and as Achintya has already introduced, I am the Director of Strategic Communications at Enactus KISS-KIIT. And I would like to take this opportunity to thank you for gracing us with your presence on behalf of Enactus, Kamakshi, Kimaya, and Wordsmith. Thank you so much for taking out time from your busy schedule and answering each and every question with a lot of patience and in detail, and helping us take our campaign to another level. And we are really, really thankful for your presence today. And I would also like to extend a very big thank you to all our collaborative societies, Kimaya, Kamakshi, and Wordsmith. Thank you so much, everyone, for understanding our cause and supporting us. And thank you so much to all the participants who joined us today. We are really, really grateful for your presence and your participation. That would be all from my side.
Thank you, Shrija. Well, time never stops, and sadly, we are at the end of this amazing webinar. As a youth, we have a responsibility to change the conversation and erase the stigma surrounding periods. So let's come together with this beautiful initiative to create awareness.
But for now, we would like to thank each one of you who took out the time to be present here. Menstruation has always been a difficult topic to have conversations about. But we really hope that this webinar was able to stir something within all of you. And I would like to leave my audience with a message that the secret of change is to focus all of your energy, not on fighting the old, but on building the new. Thank you all. Stay safe, stay connected, spread awareness.
Thank you.
Thank you, ma'am.
Recording stopped.
Before we leave, can we have a picture of everyone?